Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, LinkedIn, Twitter, Instagram, and on Telegram, the links of which is given in the description box below. And in conversation with me today on the Tooth Talk, I have Dr. Chandrashekar BR. To give you a brief introduction about Dr. Chandrashekar, Dr. Chandrashekar BR is a professor and head of the Department of Public Health Dentistry, JSS Dental College and Hospital, Mysore. He completed his BDS from the VS Dental College and his PG from the JSS Dental College in the year 2005. He is a PhD in Dental Sciences from the Pacific Academy of Higher Education and Research University of Health Sciences, Udaipur, Rajasthan. Dr. Chandrashekar secured a distinction in the Framer Fellowship program from the PSG Framer Regional Institute, Coimbatore. Currently, Dr. Chandrashekar carries out administrative roles as the chairman, Board of Studies, member Academic Council, member CCLPE, member of the Subcommittee for Framing Syllabus for PhD program in the Faculty of Dentistry, JSS, Mysore. He is a member of several committees, including the Indian Association of Public Dentistry, National Steering Committee for Curriculum Reforms, and a life member of the Indian Society of Dental Research. Dr. Chandrashekar has several papers published in national and international journals. He has several scientific papers presented in national and international conferences. He is a peer reviewer of several journals like the Bulletin of the World Health Organization, European Journal of Dentistry, Annals of Medical and Health Sciences Research, Dental Research Journal, to name a few. He has won several awards for his contribution to public health dentistry, including the best paper in the 24th National Conference of the Indian Association of the Public Health Dentistry held at Hyderabad, and has a gold medal and an award titled the Mani Bhagyalakshmi Silver Jubilee Endowment Award for the Faculty of Public Health Dentistry, and the highest research output of the year award in the year 2018 and 19. Dr. Chandrashekar, that is surely a huge achievement, I should say, especially in the field of public health dentistry in India. So how does it feel for you to be in so many committees and do the constant work on public health dentistry in India?
Actually, it will be what you call a hectic schedule every day. I'll come at around 8:15 or 8:30, and only my attender should come and tell me like, sir, it's already 4:30.
I know.
Till then, we will be working on some other administrative work, and it gives like lot of what you call pleasure doing
satisfaction.
So.
Yes. So, Dr. Chandrashekar, since you are in the field of public health dentistry, and I think you deal a lot with issues and problems that are related to public dental health. And I think dental caries or tooth decay is one of the most common, we could say, a public dental health issue, even in India, with the number of cases of decay that is going up in every patient, whether it's a child or an adult. So as dentists, when we tell our patients, we routinely recommend and we say, use a fluoridated paste. Fluoride is an element that can help reduce tooth decay in your child or in yourself. As a public health dentist, what exactly do you see should be the concerns when it comes to fluoride, fluorosis, or fluoridation in India?
See, when it comes to major dental public health problems in the country, we take only 5 oral diseases. One is dental caries, second gingival periodontal diseases, third will be malocclusion, and then oral cancer, and probably dental fluorosis also. So dental fluorosis and dental caries are very closely related to each other. How? I'll tell you. See, initially, probably in the first part of 20th century, dental caries was not at all a disease to be considered as a major dental public health problem in countries like India or developing countries. Because of drastic changes in the dietary habits, probably from 1980s onwards, caries started declining in most industrialized countries, and it increased in developing countries like India. And most of the developed countries have started even using fluoride as the first line preventive agent.
Yes.
So in the form of systemic fluorides, like they fluoridated their water supplies also. Fluoride was incorporated into the salt that was regularly used. Then it was incorporated into the milk also. They tried several means. Then
Yes.
after all these things, finally they started incorporating fluoride into the toothpaste
Water.
and mouth rinses also, along with dentists being professionally applying fluorides. And because of extensive use of fluorides only, dental caries was under control in most of the developed countries. But in a developing country like India, fluorides cannot be incorporated systemically. Like
Yes.
systemically means fluoride needs to be ingested
Yes.
through oral route, or it should be consumed like tablets. All these are systemic administrations for like in case if we need to use systemic fluorides, the water needs to be added
Fluoridated.
with some amount of fluoride wherever it is deficient. But in a country like India, we have around, like as per the data from National Water and Sanitation Board in 2014, around 230 districts, 230 out of 718 districts in the country are considered as endemic fluoride belts only. That means the water is having a high concentration of fluoride in them. So like fluoride concentration in the water in India ranges from zero point 0.2 ppm. ppm means it is 1 ppm. If I say it is 1 milligram of fluoride in 1 liter of water. So it ranges from zero point 0.2 milligram per liter in some areas to 48 milligram per liter in some other areas. That is the huge
Huge.
concentration.
Yes.
So according to Ministry of Health and Family Welfare, any concentration of fluoride which is up to 1 ppm is considered as a permissible limit. It is permitted to be consumed.
Yes.
Concentration of 2 ppm, 2 milligram of fluoride per liter is considered as like high dose. It is considered to be like not a recommended dose for like human consumption in the form of drinking water. So we have this dual issues. Dental caries also is very high
Yes.
among children especially. At the same time, because of extensive use of fluorides and
Yes.
because most of the states in the country are endemic fluoride beds, dental fluorosis also is a
Problem.
like major dental public health problem. So we have both the issues. So systemic consumption of fluoride is not at all there in the country.
Yes.
See, use of systemic fluorides like has several drawbacks. Like in a country, democratic country like India, in case if you start adding fluoride into the regular water supply, so it forces everybody to drink,
Yes.
whether you like it, whether you don't
Oh,
like it, because use of fluoridated water by somebody who is having an issue with a kidney disease,
yes.
that's a contraindication. They cannot consume water having fluoride in it. So when you add fluoride into the water supply itself, it forces everybody. It doesn't give any choice for the
Yes.
people to choose. So that is the reason why systemic fluorides are not in much use in most of the developing countries. In India, there is nothing like systemic fluorides have ever been used. Like other form of systemic fluoride will be in the form of fluoride tablets.
Correct.
Fluoride tablets also not used in India because the caries preventive benefit what we get from fluoride is because of remineralization.
Correct.
When the caries is happening on the tooth, when there is an incipient carious lesion, if you
Yes.
give some fluoride in the form of topical
Yes.
fluoride, it facilitates remineralization while preventing demineralization. This is
Correct.
the major mechanism in caries prevention. So
Yes.
when we are able to get that caries preventive benefit from topical fluorides only, when the systemic fluoride benefit that is derived through systemic effect is very, very negligible, there is no point in considering systemic fluoride for that negligible caries prevention, which may be probably 0.5%. Remaining 99.5% of caries preventive effect is through topical effect only in the form of remineralization. So, topical fluorides are the ones which are the first line of preventive agents for preventing dental caries, even today,
Even to
everywhere.
everywhere.
Yeah. So, when we think about topical fluorides, we have professionally applied topical fluorides and self-applied
Yes.
topical fluorides. Professionally applied topical fluorides means anything that is applied by a dentist in a dental clinic because they will be having very high concentration of fluoride and it cannot be administered by people themselves. This is one category.
Yes.
And other one is self-applied. As the name itself says, it can be applied by the people themselves.
Themselves.
So the major advantage of self-applied topical fluorides is they need not have to visit a dentist every time. They need fluoride application. And in case if fluorides are to be applied only professionally, the cost of like preventive strategies will be very high. So to combat that issue, self-applied topical fluorides were developed. And when we think about it, fluoride was incorporated into a toothpaste because brushing with a paste is a culturally ingrained practice for everybody. So
Yes.
when you incorporate fluoride into a paste, everybody will start using that fluoridated paste on a daily basis. That gives lot of benefit in terms of preventing dental caries. Second one will be in the form of fluoride mouth rinses for daily use. Sodium fluoride mouth rinses are available, but they will not be sold over the counter without prescription. Our dentist will analyze the caries risk of an individual. If he prescribes, then probably sodium fluoride mouth rinses will be available. Now, what will happen here is, in a country like India, take for example my own family, I'll buy one toothpaste. Our toothpaste will be fluoridated. Most of the commercially available toothpaste today are fluoridated, and they are fluoridated with the intention of preventing dental caries, which is a major dental public health problem. So, those fluoridated toothpaste will have fluoride in a concentration of probably 1000 ppm, quite a high concentration of fluoride in it. When a young child of probably 2 years start using a paste, adult formula toothpaste, they inadvertently swallow some amount of like
Paste.
paste because of taste. Like when I was a kid, when I was brushing, I obviously used to swallow some amount of paste because of its taste, flavor. like that. So when children consume even small quantities of toothpaste on a daily basis, that
Correct.
also will become a risk factor for dental fluorosis. And because of this only, the prevalence of dental fluorosis among young children and adults also is rising. So I think I've explained both the issues here, why
Yes.
dental care is also increased, and now
Yes.
why dental fluorosis also is increasing.
Yes.
Besides being an endemic fluoride belt, in case
Correct.
if children start consuming fluoridated toothpaste also, the risk will be very high. So
Dr. Chandrashekar, what would you recommend? What would you recommend that the children be given a different kind of a paste, probably a child
yeah,
formula toothpaste, where the levels of fluoride is much reduced and it's optimized to that particular age.
yeah. Usually for children less than 4 years, what we advise for preventing dental caries as a public health dentist, when I keep giving talks to the general public, we say two things are very important. One, brushing in the night, and just make a habit of rinsing the mouth every time the food is ingested or every time the food is taken. Anything you eat, drink, or anything, just make it a habit to take some water, rinse thoroughly. Either you drink it or spit it. With these two habits alone, like with these two habits together, brushing in the night and just rinsing the mouth every time something is eaten or like drunk, we can prevent the occurrence of dental caries almost by 90%. So children less than 4 years, we don't recommend a fluoridated toothpaste at all. Regular hygiene and rinsing with water itself is enough. Still, in case if the caries risk is very high, as judged by a professional dentist,
Yes.
the patients cannot judge themselves. It has to be
We do the
judged based
DMFT
on
index. Yes,
the,
yes,
yeah, based
yes,
on the caries risk, past caries experience, present caries experience. Dentist will decide.
yes.
If fluoridated toothpastes are recommended for very young children, then most of the times it will be in the form of child formula toothpaste only. Between 4 to 6 years, we recommend child formula toothpaste. Their fluoride concentration will be 500 to 550 ppm only. Whereas in an adult formula toothpaste, it will be 1000 ppm. Child formula toothpaste will have half of that. And only probably a gram of toothpaste is required for every brushing. Now we can see in some advertisements that entire length of the paste will be put on a brush. That is probably a marketing gimmick. It will not give any additional benefit. Just a gram of a toothpaste means a size of a peanut.
Small. Yes.
Yeah, is more than sufficient. If you use more amount of toothpaste, it causes frothing. It will be not very effective.
Yes, yes,
Yeah, child formula toothpaste can be recommended. And when the children are brushing, parents should supervise. This is, we call it as supervised brushing by very
yes,
young children. And
yes,
children should be encouraged to spit off, not to swallow.
Yes.
And with these, probably it can be prevented. After the age of probably 10 years or 13 years, even children can start using adult formula toothpaste as well. So once the calcification is over at the end of 10 years, even if they take a high dose of fluoride, they may die because of acute fluoride toxicity in 3 hours, but their dental fluorosis or skeletal fluorosis will not get changed much.
Okay. Okay. So, Dr. Chandrashekar, if you say that most of the areas, like most of the districts in India are high endemic areas, means have fluoride, have a very high concentration of fluoride in their drinking water. Then,
Yeah.
are there any measures taken by the government to do some kind of a defluoridation programs for this water? Like, say
Yeah.
for instance, even in cities, I think people have started using a lot more of groundwater along with the government supply water because of shortage of water. Most of them drill bore wells and much deeper and pull out water from the ground. So do you think even these waters reserves will have more fluoride in them?
Yeah, this is a very good question. Actually, the surface water has very small amount of fluoride in it. And as you go deeper into the Earth's crust to fetch water, the concentration of fluoride in the water keeps increasing. And because the surface water consumption in the recent times is reduced and we rely more on groundwater resources for drinking, the concentration of fluoride in the drinking water also keeps increasing. And consumption of water having a high concentration of fluoride results in dental fluorosis when it is not too much, probably up to 2 to 3 ppm. It causes only dental fluorosis without skeletal fluorosis. If it is between 4 to 8 ppm, then along with dental fluorosis, people will start having skeletal fluorosis also. So beyond 10 ppm, if they have a fluoride concentration in concentration of 10 ppm or more, they consume for a long time, it causes genuvulgum and osteoporosis of the limbs. So it can manifest itself as dental skeletal fluorosis, non-skeletal fluorosis also. And to combat this, I told 230 districts are identified to be endemic fluoride belts in India. And the government of India has initiated national program for prevention and control of fluorosis in the 11th 5-year plan in 2008-9.
Okay.
So in the initial phase, they took only 100 districts from 17 states for defluoridation program. And in the first phase in 2009 and 10, Mysore and Bellary were selected.
Okay.
Then in the second phase, they included other districts also, like Tumkur, then Davangere. Even Bangalore urban is covered under National Program for Prevention and Control of Fluorosis. And you
Okay.
might have seen these RO plants being given for
Yes.
drinking water consumption now.
Yes.
And this is all given under National Water Supply and Sanitation Program. So
Okay.
now National Water Supply and Sanitation Program is also working along with National Program for Prevention and Control of Fluorosis. So wherever the concentration of fluoride is identified to be more than the permissible limit or acceptable limit, they are initiating this safe drinking water in the form of reverse osmosis. Wherever feasible, they'll look for an alternate source, preferably surface water source where the fluoride concentration is less and water is safe.
I'm here. I can hear
Yeah,
you.
yeah. Where surface water is not at all possible, then they may take groundwater and they'll subject that water for reverse osmosis, which is one of the methods for defluoridation.
Okay, okay.
Yeah.
I think that was a very informative talk, I should say, Dr. Chandrashekar. But I was just thinking, just maybe one last question. So, like
Hmm.
when we say fluoridation, when we say we need to have the optimum levels of fluoride for kids because it's in the growing phase and in the
Yeah.
mineralization phase we would need it. How important would it be for adults? Like we prescribe the fluoridated paste for adults also to use. So would that have any kind of an actual impact about reducing the risk caries in, the caries risk in adults also?
Definitely. See, once the calcification of the teeth is over, probably it gets over by about 10 years for all the permanent teeth. After that, there is no risk of increasing the severity of dental fluorosis, even if they consume it also.
Okay.
So, without the risk of probably dental fluorosis, people will start getting the benefit of preventing dental caries. So, there is no adverse effect of using any fluoridated toothpaste or fluoride mouth rinse are going for a professional topical fluoride application after 10 years. So it is absolutely required, especially for people who are at a high risk of dental caries.
Yes.
So when a person visits a dentist, dentist will evaluate if professionally applied topical fluorides are required along with self-applied topical fluorides on a daily basis. It should be done. Like for children having early childhood caries, you can see all the teeth will be decayed at the age of around 2-3 years only.
Yes.
So for such kids, professionally applied topical fluorides also are required along with self-applied topical fluorides because it gives super added benefit in terms of preventing caries.
Yes.
So use of fluorides in the form of fluoridated toothpaste is not at all a contraindication for adults. They can definitely use it and it will benefit them without harming them.
Yeah, sure, sure. So, Dr. Chandrashekar, thank you so much. That was a very informative talk indeed, and I think a lot of doubts or queries that our patients would have with relation to, why they should use a fluoridated paste, and it's better to use a fluoridated paste. I hope this talk does give them some information about this particular aspect of tooth decay.
Yeah, thanks a lot. I don't know how far I've helped
No,
in
no,
communicating in understandable language, but I tried my best.
yeah, thank you so much for joining me today in today's to talk with your dentist conversation, and I really hope I can get you back to share all your knowledge and so many years of research and the work that you're doing in public dental health field. I think it's tremendous, and I really hope. I know you're on the committee of so many of these projects and programs that are working towards it. And I really hope I can get you back to do another topic on public health dentistry.
Definitely. It is my job actually. Creating awareness among the general public is what we are expected to do. And that's what I've done. And thanks a lot for giving
Thank,
me this opportunity.
thank you. Thank you so much, Dr. Chandrashekar.
Yeah,
Bye.
thank you. Bye.
So, viewers, that was Dr. Chandrashekar, who did talk to us and share all his knowledge and expertise about dental health caries and fluoride and how you can prevent dental caries, that is tooth decay, and keep your mouth and teeth healthy. I hope that talk was helpful. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. And if you would like to contact Dr. Chandrashekar, his contact details are given in the description box below. So until next time that I come back with another expert who will talk to you about your oral and dental health, keep smiling, stay safe and be happy. Thank you.